If you've been having pinching in the shoulder and all the rotator cuff exercises in the world haven't been making a difference for you, then this one's for you. Hi, I'm Jeremy Pastor. I'm the owner of Game Changer Physical Therapy. And every single week, I get new patients coming in who have experience either at other clinics or trying to treat themselves for a history of some type of shoulder impingement, or maybe there's some type of rotator cuff or labral tear, and they're wondering why their past efforts have not been getting the changes that they're looking for. Well, the most common thing that I see when I ask about the things that they've been trying to address their pain is everyone ends up bringing up these small muscles that stabilize the shoulder that we call our rotator cuff, and they talk about doing a lot of banded rotational exercises and lifting small weights somewhere between 1 and 3 pounds up away from their body in different angles. And this is very common to find in the traditional rehab setting because it used to be common belief that those muscles help to basically keep the golf ball, the head of the long bone of our arm, centered on the T, right, our shoulder blade, so that when we move our shoulder, we're not going to get any unnecessary movement or pinching. So we used to call it things like rotator cuff strengthening and stability of the shoulder just by doing these exercises, but unfortunately that is just missing a huge part of the picture. So I like to use models because I think visuals are really important for people, but notice I'm holding a rib cage here, and the rib cage is the most misrepresented portion of shoulder rehab in the traditional setting, or even more so when people are trying to treat themselves at home. So the analogy I like to use is think of the rib cage like the train tracks, and then think of the shoulder as a whole like the train. If the tracks are faulty, for lack of a better word, then the train is most likely going to crash, or there's going to be some type of damage to the train. Depending on the ride itself, right, there could be irreparable damage where we might need surgery, or there could just be bumps and bruises along the way that we need to address in order to be able to get that back on the tracks pain-free. But if we're not able to assess and identify what is going on at the tracks, and all we do is focus on the train itself and constantly do a lot of these superficial, arbitrary exercises to work on muscles that just manipulate the train itself, and we put it right back on the same faulty tracks, then the next time we go for a long ride, we're just not setting ourselves up for success, and it's a pretty high likelihood that at least some point down the line, that train is going to crash again. So what I do at Game Changer Physical Therapy is I give a really large emphasis on being able to identify what's going on at the rib cage, because our shoulder blade and our long bone in our arm just sit directly on top of the rib cage. So any movement that occurs at the ribs is going to influence the position my shoulder is in, and the position my shoulder is in is going to dramatically influence how the muscles that control the shoulder behave. So if you've been doing a lot of rotator cuff exercises and a lot of shoulder isolated movements and you're not seeing the change that you want, chances are you're just not looking at the whole picture, and we need to look closer at what's going on at your rib cage.